Sharday McCollins, Spring 2025. Today is January 24th, 2025, and my instructor is Dr. Helen Mitchell. I'll go ahead and scan the room. All right, I'm gonna start the assessment by examining my patient's skin, and I'm gonna make sure I do this in the head, face, neck, anterior, posterior chest, abdomen, upper and lower extremities. I'll be checking for color, temperature, moisture, texture, turgor, lesions, scarring, bruises, and nevi. So I'll do that throughout my assessment, and then I move on to the scalp and the head. I'm looking for any hair distribution. I'm looking for hair distribution, hair color, hair texture, lesions, masses, depressions, infestations, and tenderness. Okay, then I'll go ahead and palpate the temporal artery for any tenderness. Okay, and then with that, I'll go ahead and turn it to the side. I'm going to palpate the lymph nodes, preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, supraclavicular. Okay, go ahead and turn around for me. Also with that, I'm gonna palpate the TJM for any subluxation, tenderness, or crepitus, and then I'll palpate the masseter muscle and have you to clench your jaw. Okay, that is sensory nerve 5, trigeminal, and that is the motor component. The sensory component, you let me know when you feel this.
I feel it. I do.
All right, so she felt that. The sensory touch for her forehead, it was on her forehead, cheeks, chin, and nose. So cranial nerve 5 is intact. So then we're gonna move on to cranial nerve 7. I'll get you to smile, frown, raise your brows, puff your cheeks, and puff your lips. Okay, so that is cranial nerve 7, which is facial. And then we're gonna go ahead and move on to the ears. So I'm gonna look at the shape and looking at the size, it's symmetric. And then I want to take a look with my otoscope, and I'm going to inspect the auditory canal and the tympanic membrane. I'm checking to make sure that it is clear and the tympanic membrane is intact and in pearly gray. I want to palpate the pinnate and the vagus, check for any masses and tenderness. Also, go ahead and complete my test. So we'll do a whisper test. Okay, what was it? Say it louder.
ABC.
All right, thank you. All right, so that was the whisper test, and then I'll go ahead and test for lateralization. Let me know if you hear it in both ears or one or neither. Okay. All right, so I'll let you know. Let me know when you stop hearing the sound.
Stop.
All right.
Stop.
Okay. Let you know.
Stop.
Okay, so air conduction was greater than bone conduction, and that is cranial nerve 8, the vestibular cochlear. All right, then we're gonna move on. Looking at, take your glasses off for me. Okay, we're moving on, looking at her eyes, looking at her brows, her lashes, her palpable fissures, and also I'm checking the sclera and the conjunctiva or any lesions, discharge, or undercolor. All right, so the next thing I'm going to do, we're going to do our visual acuity test. So I'm going to get you to cover one eye and let me know the smallest print that you see.
LT, LPH.
Okay.
LT, LPH.
All right. And the next thing we'll do, that was visual acuity. So the next thing I want you to do is cover one of your eyes. Okay, we're going to check for peripheral. So let me know when you see, look at me and let me know when you see my hand.
Right there.
Other eye. Look at me.
Right there. I see it.
You see, let me know when it comes in, you see it.
Yes.
Okay, all right, so that was the visual acuity and the peripheral and the central vision. So that's cranial nerve 2 optic. Cranial nerve 3, which will test for oculomotor, we're looking for direct and consensual pupillary response to light. So look straight ahead for me. Okay. and also, all right, so that's cranial nerve 3, oculomotor. And the pupillary response, all that was intact and normal, and also the convergence and accommodation. So the next thing we'll move to is we're going to test the conjugate gaze with extraocular movement. So cover one eye for me and follow my hands with me. My hand, okay, cover the other eye. Follow my hand. All right, so that was cranial nerve 3, 4, and 6, oculomotor, trochlear, and abducens. Okay, and so the next thing we're going to do, we'll take a look at the nose. It is midline, it is straight. I'm going to test for patency, smell that, and smell.
Yes, I did.
Smell both, okay.
I do.
Perfect. All right, so that is cranial nerve 1, olfactory. All right, then we'll move to the mouth. Okay, open. All right, perfect. So with that, I am inspecting the lips, the tongue, the teeth, the gums, the palate, the floor of the mouth, the salivary glands, the posterior pharynx, and the tonsils. The tonsils were not present, so I'm not able to grade those, but they're all intact. Also, cranial nerve 9 and 10 are intact. I did see symmetry when the uvula and the palate rose. They did rise symmetrically with phonation, so that was 9 and 10. So that's the glossopharyngeal and the vagus, and also cranial nerve 12 was the tongue midline without vacillation. So I was able to verify that that's intact. Okay, next thing I'm gonna do is feel the trachea and her thyroid. Go ahead and swallow for me. Swallow for me. All right, and then I feel the carotid pulse. I'm feeling for the pulsation. Then I'm gonna listen for any bruits. Okay, all right. So the next thing I want to do is I need you to look. I need to see your back. Thank you. All right, so I'm checking for symmetry. I'm checking for any deformities. I'm looking to see if there are any signs and symptoms of distress, such as use of accessory muscles, nasal flaring, retractions, cyanosis, tachypnea. All right, and with that, I'll go ahead and test for the tactile perimeter. Say 99.
99, 99, 99, 99.
I will percuss in those intercostal spaces. All right, so next thing I'll do is auscultate. Close the scapula, take deep breath in. All right, and then I need you to say, I'm testing egophony, say E.
E, 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 E.
All right, I'm gonna test bronchophony, say 99.
99, 99, 99, 99, 99, 99, 99.
All right, and then I'll need you to test whisper pectoraliquy, say 99, whisper for me. All right, you can turn around. Oh, before you turn around, sorry, go back. I need to test chest expansion. That is symmetric. Go ahead and breathe. All right, perfect. Now you can turn around. Sorry about that, now. All right, so the next thing we're gonna do is examine the anterior chest. So I'm going to check for tactile perimeter, say 99.
99, 99, 99.
All right, and then I'm gonna check for chest expansion, making sure that's symmetric. Then I'll take a listen with my diaphragm and stethoscope. All right, next thing I'm gonna do is go ahead and we're gonna listen to the heart, the right clavicular, second intercostal space, that's the pulmonic. Second intercostal space on the left side, left clavicular, that is the aortic. Left, third intercostal space is aortic point. Fourth, left, fourth intercostal space is the tricuspid, and the fifth intercostal space on the left side is the mitral. And then I will go ahead and auscultate with the diaphragm and the bell in those same areas. Okay, and then I will go ahead and identify and palpate the PMI, and then I'll take a listen to the apical pulse for a minute, listening for the rate and rhythm. That is 60, and the rhythm is normal. Okay, I'll go ahead and get you to lay back for me. So she's laying back 30 to 45 degrees, and then I'm gonna go ahead and take a look. 30 to 45 degrees, I'm going to go ahead and take a look at her JVD. I'm checking for any pulsations, and then I am going to examine and make sure there's no heaves or lifts. I'm going to take my hand and I'm going to palpate for any thrills in those auscultation points. Then I'm going to take my stethoscope and I'm going to listen while she is supine in those auscultation points. The pulmonic, aortic, herbs point, tricuspid, and mitral. Okay? And the apical pulse is brittle. Also, we're going to move on to the abdomen. Contour is normal, it's symmetric, round. I'm going to take a listen first in all 4 quadrants. Okay, then I'll listen to the aorta, the renal arteries, the iliac arteries, the femoral arteries. Okay, then I'll go ahead and percuss. Tympany sounds with some dullness across the organs. And then I'll palpate for liver, for tenderness and masses. I'll get you to take a deep breath and hold it. I'm palpating the liver, and I'm palpating the spleen. All right, thank you. All right, so with that, you can go ahead and sit up. All right, so the first thing we're going to do is I'm going to look at your joints and your fingers. Look at your joints and your fingers, your wrists, your elbows, and your shoulders. I'm checking for any redness, swelling, crepitus, nodules, and tenderness. And also with that, I'll be taking a look and making sure the color, the warmth, the skin integrity, and any edema in the upper extremities. Okay, with that, really squeeze up for me. Okay, I'm going to check sensory to touch, and just let me know if you feel that.
I feel that.
Okay, so with that, first thing I'll do too, now that we're checking the upper extremities, I'm going to assess the capillary refill, radial pulses. Okay, that's there. Squeeze my hand for me. Okay, perfect. 5 out of 5 strength. I'm going to assess the vibratory sensation over the ulnar presence, over the proximal ulnar presence, which is in the wrist, on the wrist. Let me not feel that. Feel it? Okay,
Yes.
perfect. All right, so then we'll go ahead and jump into our range of motion. So we're gonna flex, extend, hyperextend. Just hyperextend, then adduct, abduct, and thumb opposition. Perfect. All right. Then we'll move to the wrist. We're going to flex, extend, hyperextend. We're going to ulnar deviate, radial deviate. All right. All right. So, and then we'll rotate. All right. Then next we're going to flex with our elbows, flex, extend, hyperextend. I'm gonna check your strength. So push against my hands, push against my hands. Perfect. All right. And the next thing we'll do is for the shoulders, we're going to flex, extend, hyperextend. Okay. We're going to internal rotate, then we'll external rotate. We're going to rotate. Okay, then we will put to the side, abduct, adduct. Okay, abduct again, and adduct. Okay, I'm testing the strength in both of those, and it is a 5 out of 5. I'm gonna get you to shrug your shoulders. That is a 5 out of 5 as well. Awesome. All right, so then we're gonna check the deep tendon reflexes. Let me see it. Okay, so there, 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 there. There. The other arm, thank you, dear. Patellar. So that was the brachioradialis, the biceps, triceps, the patellar, the Achilles, and the Babinski sign. Okay. All right. So that was that. While we're here, I'm gonna have you close your eyes. Give me one hand. Let me know what's in that hand.
Paper cut.
Okay, let me know what is in here.
Her top.
Okay. So with that, I test the sterognosis, and that's intact. And I'll test the graphesthesia. So close your eyes. I'm gonna put a number.
3.
And a number here.
3.
All right. So that is intact as well. All right. So next thing we're gonna do is the cerebellar coordination. I'm gonna test that, and we're gonna do some rapid movements, some rapid alternating movements. So you're gonna put your hands in your lap. You're gonna just flop your hands. Okay, perfect. Then you're going to do a finger to nose touch. So touch my finger, touch your nose. The next hand, the other hand, finger, that, perfect. And then after that, finger to top. Okay, and then we're going to do a radial, rapid finger opposition. So you're gonna go back and forward. All right, perfect. Okay, so we got that. Before we move on, I'll go ahead and look at your lower extremities. Okay, so for your lower extremities, we're gonna take a look. Again, we're looking for any redness, swelling, tenderness, nodules, swelling, tenderness, nodules, crepitus, deformity, symmetry, upper and lower extremity joints. Also, we're checking for the warmth, the color, the skin integrity, and any edema in her upper and lower extremities. Okay, so now that we're here, I am going to have her do a couple things. So I'm going to test a sensation. Let me know if you feel it.
I feel it.
You feel it there?
Yes, I do.
Okay. Also, I'll go ahead and check for the vibratory sensation in the medial malleolus. Let me know if you feel that.
I do.
Okay, perfect. All right, so we tested that. That's intact. All right, so I'm going to come down here, and we're going to do the range of motions with your toes, okay? All right, so we're going to flex, extend, hyperextend, then hyperextend. Then we will abduct, adduct, okay? Perfect. Let me test this capillary. Do you feel? And that is normal. And then also the posterior tibial pulse. Okay. All right. So next thing we're going to do, we're going to check the ankle range of motion. So I need you to flex, extend, hyperextend, inversion, eversion, and rotate those. Perfect. So I'm going to check for strength. So there's going to be a dorsiflexion. So press against my hand, both, and then below press. Okay, perfect. All right, we did rotate. So that was the ankles. The next thing we're going to do, I need you to push against my hands with your knees. Push against both, okay? And then bring them back, perfect. And then I need you to press, okay, again, and then press again. Perfect. All right, so next thing we're gonna do, okay, we need to stand up. Perfect. We're going to do a couple movements and range of motion with our hips. So we're going to flex, extend, hyperextend. Okay, flex, extend, hyperextend. Okay, we're going to internal rotate, perfect. And then you're going to external rotate. Okay, then you're going to rotate. And then the other one in a circle. Rotate, perfect, okay? And then we'll do the same, similar with our knee. We're going to flex, extend, hyperextend. Same thing, flex, extend, hyperextend. Perfect, okay. So now we're gonna do the same kind of similar thing with our spine. So turn that way. I need you to flex. That means go forward. Okay, right there, hold it for me, thank you. So I'm checking her spine. It is aligned. It's normal, no curvature. The shoulders are intact, no signs of scoliosis. So now you can extend, and you can hyperextend. So then you want to laterally rotate, and then you want to do a rotation there. Perfect. All right. So same thing with your head. You're going to flex, extend, hyperextend. Then you will laterally rotate, And then you're gonna rotate all around, get it all, yep, a big circle. Perfect, perfect, perfect. All right, and the next thing we are going to do is we're going to turn this way. Well, you can go ahead. I need you to walk, so just walk that way, just a normal walk. You're gonna start back here, like, yep, right there. Now go ahead and walk. All right, you can stop. All right, you're gonna come back. You're gonna do a tandem walk. So before you do the tandem walk, it is a heel to toe. So you gotta go in a line, heel to toe, heel to toe. There you go. Perfect. All right, so you can come back here, and then I need you to just stand with your hands straight. I'm just gonna test your balance. Oh, okay, close your eyes. Okay, perfect. And I will not have her to hop, just for safety reasons. She is post fracture. She had a ankle fracture, so I won't have her to hop. But you can have a seat.